Hello and welcome. Before we begin today, I want to acknowledge something real. A lot of you have told us in the comments that you feel dismissed by doctors who wave off your concerns, by a system that seems more interested in renewing prescriptions than actually checking whether you still need them, by a world that hands you pill after pill without ever sitting down and explaining what those pills are quietly doing inside your body. That frustration is completely valid, and this video is a direct response to it. Because here is something that most seniors are never told. Many of the most commonly prescribed medications in the world carry specific warnings about what they can do to an aging heart. They are FDA approved. They are doctor prescribed. They are in medicine cabinets in almost every home. And yet the risks they carry in a body over 60 are different from the risks in a younger person. The body changes, the kidneys filter more slowly, the heart is less forgiving. And a dose that was perfectly safe at 50 may be doing something very different at 70. Today, we are counting down 5 common medications that research suggests may quietly be putting older hearts at risk. Not to frighten you, not to tell you to stop anything, but to give you the information you deserve and were probably never given, so that you can have a real, informed conversation with your doctor. And when we reach number 1, you will discover the over-the-counter painkiller sitting in almost every home that the FDA itself has issued a formal warning about. A medication so familiar, it barely gets a second thought. And for adults over 60, that familiarity may be part of the problem. Before we begin, drop your age and where you are watching from in the comments. We read every single one. Now, let us get started with number 5. Number 5, proton pump inhibitors. Number 5 is a medication that millions of older adults take every single day without ever questioning it. A small pill, usually taken in the morning, that makes the heartburn and the acid reflux disappear. You probably know the names: omeprazole, pantoprazole, esomeprazole. They are known as proton pump inhibitors, or PPIs. And for short-term relief of genuine reflux disease or active ulcers, they can be genuinely helpful and necessary. But here's what most people, taking them long-term, were never told. These medications were not designed for years of continuous use. And in an aging body, the longer they are taken, the more they can quietly interfere with something your heart depends on. Here's how it works. Stomach acid is not just there to cause discomfort. It helps your body absorb a mineral called magnesium, among others. When acid levels are suppressed for months or years, magnesium absorption can drop significantly. And magnesium is one of the minerals that helps regulate your heart rhythm. The FDA has specifically warned that long-term use of these medications may be associated with low magnesium levels, and that low magnesium can contribute to irregular heartbeat and other cardiac problems in older adults. On top of that, the same reduction in acid absorption over time may also affect calcium, which means bones can weaken. Research has linked long-term use of these medications to a higher risk of bone fractures in seniors, particularly hip fractures. And anyone who has seen what a hip fracture does to an older adult understands that is not a minor concern. What you can do right now. First, do not stop your medication suddenly without speaking to your doctor. But what you should do is ask a direct question at your next appointment. Ask, do I still have a medical reason to be on this? Or has this simply become a habit? Ask your doctor about a supervised step down, which means gradually reducing your dose rather than stopping abruptly. Many people find that once they step down slowly, the reflux they feared returning either does not come back or is much milder than expected. Also, ask about practical changes at home. Elevating the head of your bed by 6 to 8 inches, using a wedge pillow or blocks under the bed frame reduces acid reflux at night without any medication. Avoiding large meals within 2 to 3 hours of sleep and cutting back on coffee and alcohol can also make a meaningful difference. And if a PPI is still medically necessary, ask your doctor for annual checks of your magnesium and vitamin B12 levels. These are simple blood tests that can catch any depletion before it becomes a problem. The goal is not to suffer. It is to make sure the relief you are getting today is not quietly borrowing from your health tomorrow. Number 4, benzodiazepines. Number 4 is one that many people reading this might recognize from their own medicine cabinet or from someone they love. A small pill prescribed for sleep or for anxiety. Something that takes the edge off a difficult night. Lorazepam, temazepam, diazepam, alprazolam. These belong to a class of medications called benzodiazepines. And for many older adults, they feel like a lifeline. But the FDA has now placed what is called a boxed warning on this entire class of drugs. That is the most serious warning the FDA can issue. And the concern it flags for older adults is significant. Here is the core problem. These medications slow down activity in the brain and the nervous system. That is exactly why they help with anxiety and sleep. But in older adults, that same slowing effect does not stay in the brain. It also slows reaction time, muscle coordination, and balance. Research suggests that benzodiazepine use in older adults may be associated with a substantially higher risk of falls, and falls at this age are not minor events. A hip fracture in an adult over 60 can lead to hospitalization, surgery, loss of independence, and in too many cases, something far worse. There is also a question about cognitive health over time. Long-term use has been associated in some studies with memory problems and mental fog. Some research has suggested a possible link to higher dementia risk in long-term users, though this area is still being studied and the relationship is not yet fully understood. And then there is dependence. The body adjusts to these medications over time. Stopping them suddenly can trigger withdrawal that includes rapid heart rate, elevated blood pressure, anxiety, tremors, and in serious cases, seizures. The medication that was meant to help you rest can become something your body cannot safely do without. What you can do right now. Do not stop this medication suddenly. That cannot be said clearly enough. If you are on a benzodiazepine and you want to explore changing that, it must be done with medical supervision through a slow, gradual taper that can take weeks or months, depending on how long you have been taking it. What you should do is have an honest conversation with your doctor about whether this medication is still the right choice. Ask specifically about alternatives. For sleep, a type of therapy called CBTI, which stands for Cognitive Behavioral Therapy for Insomnia, has been shown to be as effective as medication in the short term and more effective over the long term. It involves no pills and carries no fall or dependence risk. Ask your doctor to review whether your current dose could be reduced, even if stopping entirely is not the right step yet. A lower dose may carry less risk while still providing some benefit during a planned transition to alternatives. For anxiety, gentle daily exercise, controlled breathing techniques, mindfulness practice, and certain non-sedating medications can all help without the same risks. Your sleep and your calm are real needs that deserve real solutions. The question is simply whether this particular solution remains the safest one for you. If you are finding this video helpful, please take a moment to like it, subscribe, and hit the notification bell. Now let us move to number 3. And this one is about a medication many seniors take every day to protect their heart, but that may be creating new risks at the very same time. Number 3, heart and blood pressure medications. Number 3 is the most complicated entry on this list because the medications in it are for many people genuinely life-saving. Diuretics, beta blockers, calcium channel blockers, ACE inhibitors. These are the medications prescribed to manage blood pressure, protect the heart after a cardiac event, and reduce the risk of stroke. For millions of older adults, they are essential, and stopping them without medical guidance can be dangerous. So, why are they on this list? Because the problem is not always the medication itself. The problem is what happens when the dose that was right for your body at 55 is still the same dose at 75, and nobody has reviewed it. Here's what research tells us. As the body ages, the kidneys filter more slowly, and the liver processes medications differently. This means that the same dose can build to a higher effective concentration in an older body than it would have in a younger one. A study published in JAMA Internal Medicine followed thousands of older adults and found that those on blood pressure medication had a significantly higher risk of serious fall injuries. In some cases, the risk more than doubled. Why? Because one of the most common side effects of blood pressure medication in older adults is a drop in blood pressure when standing, a condition called orthostatic hypotension. You stand up, blood pressure dips, and for a fraction of a second, the brain does not get quite enough blood. You feel lightheaded. You reach for something, or you do not reach in time. Diuretics can also cause the body to lose potassium and sodium, which affects heart rhythm. Beta blockers can slow the heart rate enough to cause unusual fatigue, breathlessness, and reduced exercise tolerance. And calcium channel blockers can cause leg and ankle swelling that looks like heart failure but is actually a medication side effect. What you can do right now: keep taking your medications. That is the starting point, and it is non-negotiable without a doctor's guidance. Ask your doctor to check your blood pressure while you are standing, not just sitting. This takes about 60 seconds. Ask to have it measured 1 minute after standing and again at 3 minutes. A meaningful drop in either reading is a clinical signal that your dose may need adjusting. Bring a home blood pressure log to your appointments. Take readings each morning before eating or drinking anything at the same time each day, and note them in a small notebook or phone. This gives your doctor genuinely useful information that a single reading in a clinical setting cannot provide. Ask directly at your next appointment. Given my age and how my kidneys are working now, is my current dose still the right one? And watch for these signals in yourself. Dizziness when standing, a pulse consistently below 50, unusual fatigue after a prescription was changed, or new leg swelling. None of these automatically means a medication is wrong, but all of them deserve a conversation. Number 2, polypharmacy. Number 2 is not a single medication. It is what happens when medications stack up over years until nobody is looking at the whole picture anymore. Polypharmacy is the medical term for taking 5 or more medications at the same time. And in adults over 65, it is remarkably common. Research suggests that roughly 4 in 10 older adults take 5 or more prescription medications every day. Many take far more. A pill for blood pressure, something for cholesterol, a sleep aid, something for pain, an acid reducer, a vitamin, a mood stabilizer, each one prescribed for a reason, each one reasonable on its own, but never fully tested in combination, and rarely reevaluated as a complete package. Here is what can happen in the body when medications accumulate over time. Every drug the liver and kidneys have to process adds to their workload. As that workload increases, drugs can remain in the system longer than intended and reach higher concentrations than expected. They interact with each other in ways that neither prescribing doctor may have foreseen. And side effects from one medication can be misread as a new symptom, which then leads to a new prescription to manage that symptom. Cardiologists call one version of this the prescribing cascade. And once it starts, it can be very difficult to untangle. Research has found that among older adults with cardiovascular disease, the majority may have at least one significant potential drug interaction that neither they nor their doctors are aware of. The consequences range from fatigue and confusion to falls, hospitalization, and in serious cases, cardiac events. What makes this so hard to see is that the symptoms of medication overload look exactly like the symptoms of aging. You feel more tired, you are less steady, your memory feels cloudier, your digestion slows, your mood shifts. And every time you mention these things to a doctor, the assumption may simply be that this is what getting older feels like. But sometimes it is not. Sometimes it is the pills. What you can do right now: start with one concrete task this week. Write down every single thing you take, including prescription medications, over-the-counter pain relievers, sleep aids, vitamins, herbal supplements, and anything else you take regularly. Everything. Then, bring that complete handwritten list to your next appointment and ask specifically for a medication review. Not a check-in, a review. A dedicated conversation where every item on that list gets evaluated for whether it is still necessary, whether the dose remains appropriate, and whether anything is potentially interacting with something else. Ask whether a pharmacist specializing in medications for older adults could review your list. Many pharmacies now offer structured medication review services specifically for seniors, and these appointments can be enormously valuable. Use one pharmacy for all your prescriptions whenever possible, so the pharmacist system can automatically flag potential interactions. And every time a new prescription is written, ask the prescribing doctor, does this interact with anything I am already taking? If you like this video so far, please hit the like button and subscribe so we can keep bringing you content like this every week. And now let us reach number 1, the most common painkiller in almost every home, available without a prescription, and carrying an FDA warning about your heart that most people have never read. Number 1, NSAIDs and common painkillers. Number 1 is sitting in almost every medicine cabinet in the world. Ibuprofen, naproxen, diclofenac. You probably know at least one of these names. You may have taken one this week. They are called NSAIDs, non-steroidal anti-inflammatory drugs, and they are trusted, familiar, and easy to reach for when pain strikes. Arthritis, flaring up, back aching, headache that will not quit. A tablet or two seems harmless. But here is what most people taking these medications were never told. In the year 2015, the FDA updated its formal warning on this entire class of drugs. The label now states that the risk of heart attack or stroke may begin as early as the first few days of use, not months of use, days. And the risk may increase with longer use and higher doses. The FDA specifically identifies older adults as a population at heightened risk. Here's the mechanism that makes this so important to understand. NSAIDs work by blocking certain chemical processes in the body that cause pain and inflammation. But those same chemical processes also help keep blood vessels relaxed and prevent blood from clotting too easily. When they are suppressed, the body can tip slightly toward constricted blood vessels and increased clotting. In a young, healthy body, this shift is minor and temporary. In an aging body where blood vessels are already stiffer, where blood pressure may already be elevated, and where the kidneys are filtering more slowly, that same shift may carry a very different level of risk. The kidney connection matters enormously here. NSAIDs can reduce blood flow to the kidneys, and aging kidneys that depend on that blood flow may struggle significantly. In older adults already taking a diuretic and a blood pressure medication, adding an NSAID creates what researchers have described as a triple combination that can strain kidney function and cause fluid retention, adding extra pressure on the heart. And yet, these medications are sold freely over the counter. They do not require a prescription. They are not treated with the kind of caution that may be warranted in older bodies. What you can do right now. The first step is awareness. If you are over 60 and taking an NSAID regularly, even one you buy without a prescription, speak to your doctor about whether it remains the right choice for you at this stage of life. For pain that does not involve significant inflammation, acetaminophen, also known as paracetamol, is generally considered a safer option for the heart and kidneys when taken within the recommended limits. Ask your doctor directly whether this applies to your type of pain. For joint or muscle pain, topical diclofenac gel applied directly to the skin over the painful area has been shown to provide meaningful relief with only a fraction of the systemic absorption of a tablet. This can significantly reduce cardiovascular risk while still addressing the pain. Ask your pharmacist or doctor whether a topical version is appropriate for your situation. Non-medication approaches can also be remarkably effective for many types of chronic pain. Heat applied to stiff joints for 10 to 15 minutes before movement in the morning can reduce arthritis discomfort significantly. Gentle physiotherapy for lower back pain has strong evidence behind it. Swimming or water-based exercise for joint conditions provides movement without impact. These carry no cardiovascular risk and can often combine with safer medication options for better results than a painkiller alone. If you are on low-dose aspirin for cardiovascular protection following a heart event, that is a separate and different matter with a different mechanism. Do not change that without your cardiologist's guidance. This warning applies to the other NSAIDs taken for pain relief, not to aspirin used for heart protection. And if you ever experience chest discomfort, sudden shortness of breath, leg swelling that develops quickly, or a significant reduction in how much you are urinating while taking a painkiller, seek medical attention without delay. These are signals that deserve to be taken seriously. Here is what today's countdown tells us, and it deserves to be said clearly. The medications you take every day were not all designed with your body as it is now in mind. A body that has been changing, kidneys that filter differently, blood vessels that have aged, a heart with less margin for error, and yet prescriptions get renewed automatically. Side effects get attributed to getting older. And the full picture of everything you are taking at once is rarely examined the way it should be. That is not your fault. It is a gap in how the system often works. But now you have the information to ask for something better. 5 medications, 5 conversations worth having with your doctor. Ask whether your acid reducer is still medically necessary, or whether it has simply become a habit that outlasted the original reason. Ask whether your sleep medication is something your body could safely and gradually move away from with proper support. Ask whether your blood pressure and heart medication doses are still calibrated to how your body works today. Ask for a complete medication review where every pill on your list gets evaluated as a whole picture. And ask about the painkillers you reach for without thinking, because over-the-counter does not mean without risk in a body over 60. None of this is about fear. It is about being an informed advocate for your own health. You deserve that conversation. You have the right to ask for it, and the doctor or pharmacist who will have it with you honestly is one worth keeping. Which of these 5 surprised you most? Leave it in the comments below. And if you are navigating a complicated medication list yourself or with someone you love, please share your experience. We read every single comment, and your story might be exactly what someone else watching right now needs to hear. If you found this video helpful, please like, subscribe, and hit the notification bell so you never miss the next one. And share this with someone you care about who is over 60. This might be the most important conversation you start for them this week. Thank you for watching, and we will see you in the next video.